Seems like the measles are coming back, and people are now experiencing outbreaks of the measles.
Yeah, that seems to be the case. I mean, the elimination was in 2000, so it's been 18 years ago. The lowest number in the United States, I think, in the last 18 years was 37, and that was in 2004. And then in 2014, I think there was over 600 cases. Still a small amount in comparison to what it used to be in our country. And like I said before, what seems to be happening, and as they trace these outbreaks back, is that there are unvaccinated travelers who get the measles most often when they're traveling abroad, and then they bring it back to the United States. And it doesn't take much to start spreading to people who aren't vaccinated. Certainly it can be spread to children who aren't fully immunized, because there is a schedule where they get various shots over a certain amount of time, and they aren't fully immunized until those series of shots are done.
Okay.
So, it can be spread to children, and, children and older adults, these diseases can be, very serious, can lead to hospitalizations, can lead to all sorts of things, as well as death. And obviously we don't want to see that, and so that's why, we urge people to make sure they have their immunizations up to date, and every time they go see their doctor, just talk to them about that. I know when we used to take our kids in, we'd just say, all right, here's our child. What do we need to do now? Because it's hard for us to keep track of all those.
Right. We're going to have to give out the first of all, let our listeners know who are just tuning in, the listeners who are just tuning in, that you are listening to Partners in Health and Biz. The show this morning is Immunization Awareness with my special guest, Tom Schafer. And Tom is here, and he has a wealth of information to share with us. The call-in number to Partners in Health and Biz is 347-945-7433. 347-945-7433. We'll have time for one caller and one question this morning. Just want to remind my listeners that next Saturday, tune in. My co-host, Wendy Meyerhoff, will have a special show, Disaster Preparedness, her show. Do you know what to do in case of a terrorist attack or a statewide emergency? Are you prepared? So next Saturday her show airs from 10 o'clock until 10:30. Then you can tune in and listen to that show, Disaster Preparedness with Wendy Meyerhoff. So back to our discussion, Tom. So thank you for sharing that information. It's back to school time, and I know we have listeners out there. But what should parents be doing about immunizations? Are immunization requirements different from state to state? Because we have listeners all over the United States listening this morning, even in other countries. So we want to get our kids prepared for back to school. So what should they know?
Well, that's a great question, and you're absolutely right. Each state has their own requirements for school admission. Being from Illinois, I can tell you that states, there's certain things that you have to have, and if you don't have them, you can be excluded from school. And it's usually by about the middle of October that you have to have your vaccinations up to date, or they send you home. So it's important for parents, and it's kind of getting a little late because it's tough to get in to see your doctor sometimes when it gets close to school. But each and every year, parents should be thinking about that, and maybe even start as early as January or February when they're starting to schedule their, summer visits with their pediatrician, just to, make sure that they have their vaccinations up to date. And it's hard for parents who are working, and, sometimes there's transportation issues. Sometimes there's, even a lack of having a healthcare provider. So there's various things that they can do to ensure that their children are protected. But this is that time of year where you need to be thinking about that. As your kids enter, whether it's preschool or elementary school, middle school, high school and even universities and colleges have certain requirements. One of the more new ones is something called meningococcal disease, where there have been a number of outbreaks on college campuses. So a number of colleges and universities are requiring immunization against meningococcal disease prior to their admission to school. So, it's this lifetime of immunizations, whether you're an infant or school age, or as we might get into here later, adults, there's immunizations that we should be doing. So, again, the most important thing is when you see your doctor, whether it's for a physical or, sports physical, or you go in because you're sick, check with your doctor to make sure you have your immunizations up to date. And,
up to date, right.
And, there are things as we get older, particularly, adolescents need additional vaccines to extend the protection of things that they received as they were an infant. And, again, it goes back to, protecting not only yourself, but your classmates and the other people that
Absolutely.
you interact with.
Right. I remember when my son was growing up, I had a little book that was given to us by his doctor as an infant, and it had in there all the vaccinations that he needed from birth all the way up to, I think it was through the end of high school. And every time he would go in, we'd take that little booklet and they'd check off, which immunizations he'd already had, and then we know which ones he still needed. So, yes. Now, go ahead. Were you going to say something?
No, I was going to say that's absolutely perfect. You were better than I was. I didn't keep a little book, but it's a very smart thing to do. I relied on their record keeping at the office, so you were doing it right.
Okay, great. So there is, when talking about our children and as they go into they're growing and they go from elementary and into middle school, there is some controversy about preteens getting, and we've seen it on television, the advertisements, getting a vaccination for HPV, the human papillomavirus, which is most often transmitted by having sex. So why is it important for our young people at such a young age to get this shot?
Yeah, that's a tough one, and it's hard for parents as they see their 10 or 11 or 12-year-old son or daughter at the doctor, and they're talking about something that that happens more usually when they're adults having sex. Mm-hmm. But the thing is, it's what it does for us is it protects our children against certain types of cancers. And wouldn't we all love to have that magic shot that would protect us from cancer? Now, science hasn't quite gotten to the point that it can protect us from prostate cancer or breast cancer or things of that nature. But this one has proven very effective in protecting against certain cancers that are caused by HPV infections. And one thing that's important to know is HPV is very common, and almost every person who is sexually active will require HPV, sometime during their lifetime without a vaccination. And, there's 14 million people CDC estimates infected each year in the United States with HPV. Now, thankfully, for most people...
And that's cervical cancer, right? That can turn into the cervical cancer if it's not treated or caught in time. Right.
And obviously, for women, there's cervical cancer, cancer of the vagina. For men, it's a cancer of the penis, or, for both, it can be the back of the throat. So the argument here, on the public health side is, why not protect, your child against something that, that they're going to be exposed to at some time in their life. And this is before they're sexually active, you get the vaccination, so you offer that protection down the road. Now,
Right.
all of us, with our children, it's kind of hard to be thinking about this innocent child, having
Right.
sex. But as we all know, that's going to happen.
Wake up, parents. That's right. Wake up, people.
Yeah.
Yes.
And this has been going on now for about 10 years. This vaccine has been offered, and it can prevent. They're thinking up to 90% of those those diseases and those cancers.
Mm-hmm.
And it's something that they're already seeing. Things like genital warts have dropped 71% amongst teen girls. So they're already seeing the statistics that are showing that this vaccine is highly effective, and it's preventing a number of different diseases. So again, it's a tough it's a tough thing to consider when you just have a child, thinking about that when they're adult or further down the road. But it's something a parent should be discussing with their healthcare provider. I mean, they're not going to pay attention to me. They probably won't pay attention to you, but their healthcare provider is their most trusted source, or it should be, and they should be talking to them about it.
I agree, and that's why we do these shows, so that people can wake up and be aware and take action. So, Tom, there are many vaccinations for children as we come almost to the end of our show. Wow, it's fast-paced here. How about adults? Should adults receive vaccinations? And could you name a few of the adult vaccinations that are available now that I've been hearing that we as adults should be getting, especially after a certain age?
Sure. Yeah, and the time does fly by here.
Quickly,
one of the most important.
Yeah. Go ahead.
One of the most important ones, and this is a good time to be thinking about it, is the annual flu vaccine that we all should get, and it's starting at 6 months of age all the way up to whatever, and particularly for adults, because it can be much more serious as you get 65 and older. But there's a number of vaccines that we should be receiving as adults, and flu is certainly one of them. There's one called Tdap, which is tetanus, diphtheria, and pertussis, and we should get a booster every 10 years. And for those of us who are older than 50, there's a recommended shingles vaccine that we should get. And for adults who are over 65, there's pneumococcal vaccines for pneumonia that we should be considering. So there's, as much as we would think as adults, that I'm done, I'm not a child anymore, it doesn't, vaccines don't end at childhood.
Absolutely, yes. And a quick question, can we get the flu from a flu shot?
No, that's another one of those myths. It's not a live virus that they shoot into us, and people talk about that every year. And sometimes you can have a reaction where you feel kind of flu-like, but you do not get the flu from a flu shot. Again, talk to your doctor about that, but very safe, and it protects us every year from some serious illness. Any of us who have had the flu know that you can be pretty miserable. So
yes, I know. I had it and I was miserable.
Yeah.
So Tom,
Gail, this is good. I'm sorry.
Oh, I was going to say. Go ahead.
Sorry, I didn't mean to talk over you. Just a reminder that the flu season is right around the corner. It can start as early as October, so this is a good time to start thinking about getting that flu shot.
Wonderful. And in our last 70 seconds, could you give us information on where our listeners can get more information about immunizations once the show is over, and tell us about that, how we can get more information?
Yeah, probably the best place to go is the Centers for Disease Control and Prevention, and that's at cdc.gov. They've got a wealth of information, all the different schedules, why it's important, the different things, the different diseases it protects against, and what those might be. So, yeah, they have a great website, and I strongly encourage your listeners to go visit that.
Okay, well, Tom, this has been my pleasure. You have shared with us a wealth of information this morning